Hello friends, this is Rich, Dr. Rashid from California. Today I am introducing a deadliest disease of the world, CVD, cardiovascular disease. It is the most dangerous disease in the world. Only in the United States, which is the most advanced and developed country of the world, only 770,000 people die every year due to the CVD. And every death in the fourth death is due to the heart problem in the United States. I am telling you that not only in the United States, this dangerous disease is all over the world. I am showing you something here that is the deadliest disease of the world, cardiovascular disease or heart disease. In 2015, 17.7 million people died from CVD. So this is the most dangerous disease. So I will explain you everything to you about this disease, that how can you save your life from this disease. So I am starting this program because my hero Malak Riaz told me that start some medical awareness program on most common disease. So this is my first lecture on the advice of my hero Malak Riaz, who is providing free food to 150,000 people 2 times a day. And that is a very expensive amount every day, cost almost $500,000. And fortunately, I also got a man here. His name is Mike Ali, who is the successful Californian businessman. Unfortunately, he should be with me, but he has a minor surgery. So next time he will be with me, and he has started a program, charity services in the United States under the Ali and Rashid Foundation Trust, in which he provides the accommodation, jobs, and the medical advices, and divorce problem, immigration problem, and many things. So his foundation trust is under the progress and very under the progress of registration. So very soon it will be registered, and next time you can see Mr. Mike Ali also with me, and we will help to people for in the every field in the United States. So I am introducing a medical device that is used in the cardiovascular disease, that is called pacemaker. It generates the impulse by the electrodes to contract the muscles and regulates electrical conduct system of the heart. So this is the most important device and it costs from 15,000 to 30,000 different devices. So I am telling you that this device saves the life of the peoples, and almost more than 500,000 people take this implanted this device every year. About 0.6 million people take this device every month. So now I am taking why this is important, the pacemaker, for your life. So now I am coming here when the people have arrhythmias, when your heart rate is not beating on regular interval. So then these problems increases. Mostly these problems cause the bradycardia, tachycardia, arrhythmias. So what is the bradycardia, tachycardia, arrhythmias? In these three conditions, we implant this device called cardiac pacemaker. So normally our heartbeat is from 60 to 100 per minute. 70 to 80 is the good one. But when bradycardia, there are three categories. When it is below 60 per minute condition is called bradycardia. From 40 to 60 per minute is called mild bradycardia. From 20 to 40 per minute beat is called moderate bradycardia. From 0 to 20 is called severe bradycardia. This is the one condition in which your pulse rate go below the 60, 40, 20, then more serious effect happens. And when these things happens, the people feel the fatigue, tiredness, malaise, confusion, light headache. So when doctor check and see the bradycardia, then ask the history, then people can say that they have a fatigue, tiredness, or sometimes confusion. The other condition for the heart is the tachycardia. Tachycardia is the heart rate is higher. In bradycardia lower, and in the tachycardia it is above 100 minute is called tachycardia. Here is all the three categories. When pulse rate goes from 100 to 150 per minute, it is called simple cardia. From 150 to 250 per minute is called proximal tachycardia. From 250 to 350 per minute is called flutter. Above 350 per minute is called fibrillation. So these are the condition, and one thing is another that is called arrhythmia. This is the goes to low or high pulse rate, but when the pulse rate normally, this is called PQRST. When this EKG show this QRST is a normal distance, then your rhythm, heartbeat goes normal. But when this QRST has a different level, one has this one has low, one is more, then it is called arrhythmia. Means it is not beating in a regular intervals. So same thing, mostly these problems happen in the bradycardia or atrial fibrillation in the old age. Old age or inheritity or the some old cardiac surgery or cardiac attack, then these things starts. Now I am telling you that what is the treatment. When these things are severe, then the doctor advised the pacemaker that I just introduced you. In the 70s and in the before 68, these were the pacemakers, but they were bigger and very heavier. Now today's pacemaker is only 1 ounce or 28 gram. You see that this is the picture of the cardiac pacemaker, and here you can see after the surgery, you can see the picture of inside the your chest. You can see that some bulge here, some bulge here, some bulge here, and it is not done under the open heart surgery. It is the procedure of only 1 to 2 hours, and mostly 1 hour, but sometimes it will take 1 to 2 hours. So doctor gives the incision here, 2 or 3 inch incision. You see the incision here, the incision, and this device has 2 parts. One is called pulse generator. This is the pacemaker, and one part is called pulse generator. It has a batteries and also some electrical impulses in this pulse generator. And the next part is called connected with the wire. These wires are called the lead, and this lead goes to the left right atrium or the right ventricle, and this procedure is done by a special syringe and needle. So after the surgery, doctor insert a syringe with a needle, and then they put this wire inside the atria, right atria or right ventricle. Mostly there is a one lead, single lead, double lead, and this is a single lead pacemaker. But sometimes it may be double wire lead, biventricular, triple also. So depends upon the condition of the patients. So how it works? So this procedure is very simple. You don't take anything before the surgery. 6 to 8 hours you don't take anything before the surgery. And before the surgery, doctors also take your urine test, your X-ray, your electrocardiogram, and your blood pressure, because these things are important. Your urine test, your X-rays, your blood pressure, and their electrocardiogram. The electrocardiogram shows everything what is going on with the heart. So when in the, this is the, let me to give some basic knowledge of the heart. This is our heart. This is our heart, and it is a in the male about it is a muscular organ, and it is 10.5 ounces in the male and 9 ounces in the female. So the upper part is called atria and the lower part is called ventricle. So right atrium, right ventricle, left atrium, left ventricle. You see in the, this is the left atrium and the left ventricle. In this part we have the oxygenated blood, pure oxygenated blood, and on the other side is a deoxygenated blood. So what happens? We have a very important thing in this heart. It is called SA node, sinus atrial node or SA node. This is the most and very important part in the heart. You cannot start a car without a ignition, so it is just like the ignition. And this sinus atrial node give us small signals to the AV node. When these small signals comes to the AV nodes, then it gives the signals to the bundle of Hus. Then it goes the Purkinje fibers, then the heart contracts. So this is the electrical conduction system of the heart, that how the heart works. So from this right portion, there are the inferior vena cava and superior vena cava. All deoxygenated blood goes to the lungs for the purification. And how we get the blood, the pure blood? From the left ventricle, push it by the aorta, and this blood go all over the body. I will discuss this. This is a very long topic, and it comes to the so many diseases. But next time I will explain a major heart attack that is called a myocardial infarction, and the minor attack of heart is the angina pectoris. That I will tell you in my next section, because if I will explain now, it will be go longer. So my video will be longer. I don't want to go longer. So I am focusing in the on the pacemaker. So this was the surgery, how the surgery was done, and patient should be take 2 weeks rest, and 4 weeks he will be fine, and but for 2 weeks he is stopped to drive anything, and because it is here, so where it is implanted, you should not raise your hands. Your hand should be down your shoulder, otherwise it stretch and give you the problem. So when the the patient don't need to stay for a longer time on the hospital, but for the precaution, doctor check again the ECG, pulse rate, blood pressure for the safe side, and they want to see that everything is going right and everything is fixed properly, and then within the 24 hours, before the 24 hours, he is discharged. And this procedure of the incision is not an open heart surgery. It is a minor surgery, just like the dental doctor give you a local anesthesia for your filling. So here we give the local anesthesia and make a 2 or 3 inches incision and make a pocket. Then we put this one, and then we'll put like this one from mostly. It is done by the under the collarbone. Here is a collarbone, and below that there is a vein that is called subclavian vein. Subclavian vein, and through the special needle we insert it. Then we put the wire, and in the wire they control. They have the electrodes. These electrodes then give the signals to the pacemaker that is called the pulse generator, and then it controls the whatever, mostly the bradycardia or the tachycardia or arrhythmias. They are controlled by the pacemaker. But after 6 weeks, the patient is able to work and he can do all his normal activities. But after 6 weeks, it is important to check his everything is going wrong, and after that he don't need. This has a battery that lasts almost 6 to 7 years. But you should check the battery after 5 years, and when it is something wrong, then the doctor will change the wires, the electrodes, and the battery. And but it will not take a longer procedure. It is more easier than we did the first time. So this is the pacemaker, and this, you see, there are two. So when these, and it is called electrodes, and these are the leads, and this is the pulse generator. So this is the thing, but most important thing is that because it is it has a metal, so when you go for the traveling, and when you go to the security checkup, then it will be alarm and the security will be alert. So doctor will give you a medical ID that you have a pacemaker on your chest. And sometimes there are problems in the chest, so you can, the doctor can also put the pacemaker on other side or in your abdomen also, and instead of the subclavian vein, they can also use another vein like cephalic vein or femoral vein, also used for this one. And the other thing is that you should avoid the MRI, because it is a metallic part. If you go for the MRI, that is the magnetic resonance, and it has a lot of magnets. So it will, if you will do it, then it will disturb the program of the your pacemaker. It is just like a small computer. Doctor program it. So if anything that is closed magnetic like MRI or radiotherapy, it is not good for this one. So must avoid from the MRI, and also plus avoid from your cellular phone. The cellular phone must be 6 inch away from the pacemaker, at least 6 inches. And when this is, if this is on your left side, then you use your right side, away. Maximum 6 inch must be away from your side. So these are the things that I am telling you. So I told you about the bradycardia, tachycardia, arrhythmias, about this one. So then the patient feel very good, and I think I told you lot of things, what the important things goes. So okay, so I think I have cleared everything about the pacemakers, and next time I will tell you about a special session will be about the myocardial infarction, that is the major heart attack, and the minor heart attack, that is the angina pectoris. That will be very interesting. And I hope the next time Mr. Mike Ali will also help me, and we will introduce and we will tell you many things about the heart. And so these things keep in your mind, save your life. And next time I will tell you the causes of the heart disease, prevention of the heart disease, cure of the heart disease, how the heart works, and how can we save from the heart disease, from the cardiovascular disease. Because I told you this is the most dangerous disease all over the world, and more than 770,000 people are dying every year in the United States. So you should be very careful. So next time I will give you a very good information about the complete heart attacks and the minor attacks about the heart. I think if you like it, please subscribe me, and I hope you will like it. And if I forget something, then I will tell you the next things. So thank you for listening, and I hope you will like this video, and I hope next week I will again present something good for you. Thank you very much. Thank you for listening. Goodbye.